Faculty-guided AI chatbots for nursing education is our episode topic. My guest is Dr. Lindsay Iverson, Associate Professor of Nursing at Creighton University College of Nursing. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Lindsay, thank you so much for joining us today.
Thank you. I'm excited to be here. Thanks for the opportunity.
Before we get into our episode topic, can you share a little bit about yourself with our listeners?
Well, my mom was an elementary teacher. My grandma would take me to the nursing home after I finished school, and I would do rounds with her. She was a hospice nurse, and so I would help with those patients, whether it was getting them their water or whatever it looked like, getting their walker for them. I was the little assistant, and I loved it. And that's when I knew I wanted to be a nurse and help others. I just felt this calling when I was starting at 6 years old. I knew that was something I wanted to be. So I pursued nursing at Creighton University. Thankful that the Army ROTC gave me an opportunity at Creighton to start there. So I got my bachelor's in 2005. I finished my master's in 2009. And so a couple years later, in 2011, I finished with my doctorate. And I am an acute care nurse practitioner here in Omaha. I practice with the CHI hospitalist group. And I have been at Creighton since the past, 14 years, I believe. So as soon as I finished with my doctorate, I said, I would love to give back to that community. I just felt this calling and this connection to Creighton. I never wanted to leave. So I said, I would love to take over the program that I just finished and graduated from. And they weren't sure if I was quite ready, but they said, we'll give you a shot. And I have been there ever since. So I am the track leader of the adult gerontology acute care nurse practitioner track at Creighton University.
Awesome. And in gerontology, in some ways, continuing the tradition that your grandmother started so many years ago.
Absolutely. I think she just gave me that passion. It just really ignited this flame of caring for others that I'm continuing to hold that flame as I teach others.
Our topic today is faculty-guided AI chatbots for nursing education. Before we get specifically into that topic, what is a chatbot?
Yeah, basically a resource, a technology resource that you can interact and engage with to help practice conversations and engage with a technology resource.
How did you get interested or involved in this trajectory of work around bots for nursing education?
I had received a grant a couple of years ago, and we had to present kind of our findings at a roundtable seminar. And I was sitting there, and another faculty said, we want you to meet Dr. Stephen Fernandez. He's in the computer science faculty in the arts and science here at Creighton University, and his main research trajectory is AI in higher education. And I said, sounds interesting. I don't know much about it. Tell me more. So we talked over the lunch hour, and I really started to generate some ideas of how I could incorporate that to my graduate nurse practitioner students. And ever since then, I think we're on our 9th or 10th project over the past 2 years of developing these chatbots and these AI avatars to prepare our students, whether they're nursing students or any sort of healthcare professional, to prepare for their future clinical practice, the real life scenarios that are so hard to navigate.
So you and Dr. Fernandez teamed up to develop this chatbot called RX24. What exactly is it and how is it used?
I have taught this advanced pharmacology going on 10 years at Creighton University. And the hardest topic for my students, no matter if they're an expert nurse or a very new nurse, is they struggle with the antimicrobial content. So the antibiotics, the antifungals, the antiviral agents, they really struggle. There's so much memorization, so much application to practice that it's just so hard to grasp and to be successful on exam. So I noticed a trend over the past 10 years that students after my third exam were not performing as well as I wanted them to, and withdrawing from the course after that exam because their exam score was so low. So I said, I have to come up with some sort of help for these students to really set them up for success. So I received an opportunity to get some national funding through the National Science Foundation, the NSF. And they said, we want to support your project. You're doing some great work here, have a great idea. And so what we developed is a chatbot avatar that's supposed to mimic me as a faculty member. And what students are able to do is prior to that exam, whether it's a month prior to that antimicrobial exam or a week before, a day before, an hour before, they're able to log on and interact with RX24. The name RX24 comes from the fact it is available 24 hours a day, 7 days a week. So me as a faculty, I am certainly not available 24/7. Students, even though they try to interact with me at 2, 3, 4 a.m., I have another life and other priorities, so I'm not able to engage in conversation to help them, tutor them, answer their questions. So I wanted them to have an evidence-based resource that they could go to instead of just Googling it. So they're able to log on to RX24, which is like a one-on-one tutor. I have the textbooks from my pharmacology course embedded into that chatbot. I have passed exams, passed quizzes, and all the PowerPoints that the pharmacy professors have completed in the past. And I have programmed that into the AI chatbot. Now, I work very closely with the computer science faculty, Dr. Stephen Fernandez, and all the great undergraduate computer science students. They develop this. They develop all of our chatbots, and this is part of their school work, their projects they have to do in order to be successful in a class. They have to develop a chatbot. And so I worked with them and developed this RX24 so students can log on, get that tutoring, that simulated faculty member to engage in review questions or to help with application questions to really set them up for success to handle that difficult content. And we're going to go live with that in spring of 2026. We're piloting now, making sure that everything that chatbot tells my students is evidence-based. It cannot interact with content and scenarios that it is not trained to be. So if they ask, how do you think the Denver Broncos are going to do this year? It's not able to engage in a conversation back with that. It is only trained for this antimicrobial content, and it's a very focused chatbot.
So what about other drugs? What if they start asking about other forms of drug classes and things of that nature?
There are so many different medications under those topics, the antivirals, the antimicrobials or antibiotics and antifungals. If they ask, what is the mechanism of action for ACE inhibitors, for example, which is a very common antihypertensive medication class, the chatbot would simply respond, I am not familiar with that content. Please ask me a different question regarding the antimicrobial content. It will redirect and help. My goal would be, after successful implementation, I want to scale this. I'm just piloting it with this antimicrobial specific content. But if it's successful, if students like it, they like the engagement, they like that instant feedback, I would love to scale it, open it up to other modules in my course. So whether that's the cardiac, the renal medications, the dermatology agents, to really, allow my students to interact throughout the whole semester instead of just that focused week.
Is this program just accessible from a desktop? Can you access it on a phone? Is it through a web portal or is there an app icon? What's the logistics of it from the student
Yeah, great.
experience?
So students will access RX24, how they ever access the learning management system. We use Blue Line or Canvas, so I can access it on my phone. They can engage with the chatbot RX24 on their phone, their tablet, on their computer, wherever they're working. So, if they're having a break during their nursing shift at 2 in the morning and they go eat their lunch and they want to ask that chatbot a question like, what are the main patient education considerations I should have for hepatitis medications? It will be able to engage with them, interact, and help them apply those scenarios over their lunch hour at 2 a.m. So all sorts of different options. My main goal with scaling this, if we receive more national internal funding as well, if we could make it an app in the App Store and scale it to other universities and really help students across the world be successful in this content.
And so right now it's limited to students that are enrolled in your specific course. What about after course completion and they're in their next semester of studies? Can they still use that as an ongoing resource?
They will have continued access. I don't know how much it will pertain to other courses, except For example, my acute care nurse practitioner students, they will take some kind of like care management courses over the next year. And so maybe once they get to the pneumonia management or a sepsis management, they would be able to interact with that chatbot. It doesn't just end. We have a continued subscription with all these tokens that students can have access to. My goal would be, like I said, to scale it, get more funding. We can broaden that accessibility far beyond a single course.
And so we're recording this in the fall of 2025. You're trialing this right now, planning to go live in the spring semester of 2026. What are your desired outcomes, or what are you tracking for outcomes that you're hopeful to achieve?
I have those trends, those decreasing exam scores over the past 10 years, students that have struggled and reached out after that content and dropping the course, which we know is not ideal for faculty or students. So I'm going to trend it. I want to see if my drop rates improve, so less students withdrawing from my course. I want to see if their satisfaction and knowledge retention have improved. So I can see that in all of my course evaluations where students in the past have said, this is difficult content, it's way too hard to comprehend, there's way too much, or I am having trouble applying it, reduce the content, provide more resources. I want to trend those qualitative comments as well to see if they're enjoying it, their interaction with the RX24, and just that knowledge retention, if it really is there. And I'll see it very easily on the exam scores.
So what excites you most about this part of your scholarship and research in using technology?
It does start at the student outcome level. So it starts kind of low. So I want to see those improved scores. I want to see the improved satisfaction. But what I ultimately can link this to is improved patient outcomes, which is our ideal situation as healthcare providers and healthcare workers. We want to improve those outcomes for our patients. So I figure if I can really train my nurse practitioner students to know this content, to apply the content on antimicrobials, it's going to improve their clinical practice in the future. They're going to be well prepared, more confident in prescribing antimicrobials, ordering those antibiotics, monitoring those antibiotics, which is going to improve the outcomes of our patients. So I'm excited to see that. I don't know what that would look like for a long-term kind of implications and study, but I think ultimately that would be the vision. But offering it to other universities, we were on the news last night talking about this. I hope that we continue to offer this for our students and students across the world to really set them up for success.
How do you envision AI helping students?
My two main priorities as a faculty is to prepare them for that future clinical practice, specifically having difficult conversations. That's one of my priorities. So we've produced several AI chatbots or avatars. The chatbot is more kind of a typed version interacting. The avatar is a real life person. So it looks like me, it talks like me, it moves my hands wildly like me. So we've developed those chatbot avatars to prepare our students to navigate difficult conversations. So we noticed a huge trend at Creighton that our students were not well prepared to have difficult, hard, complex conversations with patients. They were not set up for success. Just a PowerPoint alone is not going to prepare them. So we wanted them an opportunity to practice in a psychologically safe environment to have those difficult conversations. We developed that AI chatbot they can engage with as many times as they want to deliver difficult news, navigate difficult news, interact with that patient holistically, and get feedback. So the avatar will give them feedback on their empathy. Did they use open or closed loop questions? And did they allow for space and time? So it gives them great feedback that really helps set them up for those future conversations. And then second is that knowledge retention and that one-on-one feedback that they get, which this generation is so passionate about instant feedback and immediate results that RX24 is going to give that to them. It really speaks to that technology-driven generation, and I hope to meet what they need as well.
So the avatar that you were talking about for empathy and crucial conversations with patients, is that in RX24 or that's a separate chatbot that we're talking about?
Yeah, that's one of the several projects that Dr. Fernandez and I received grant funding for. So we piloted in undergrad nursing students and graduate nursing students last year. It's being redone this fall as well. We updated it, upgraded it after student feedback. Our student feedback was like, we wanted more realism. There was delays in technology, which, happens with AI, right? It's a technology resource. So we said we want to offer the best realistic opportunity for these students. So we invested more money into the product to give a great result to our students. So the avatar was more realistic, doesn't have that delay in communication, delays in technology. And so undergrad, graduate students, I think we had 100 last year and maybe 200 this fall, are interacting with that chatbot to practice those conversations before they go to a simulation. And so then we do it's a two-phase. They'll interact with the AI chatbot. Then the next week they come to campus to have a simulation where they have to deliver that difficult news or engage in a hard conversation. That third step is then they go to clinical practice. Our goal is that multi-phase. Did those difficult conversation practice sessions help them for simulation and the real life clinicals interacting with the patients?
What are your next steps in terms of research for AI in nursing education?
I want to make it broad. So I know I am a nursing faculty, but all healthcare students could benefit from this. I'm currently developing an app that will have a library of different chatbots and avatars that whether you're PT, physical therapy faculty, or a dentistry faculty, they'll be able to select a scenario or an avatar that fits their kind of student population. And their students will be able to engage with that avatar that's very specific to their profession. So my goal is to open up my scholarship to other professions to help prepare them. I know I'm not in a silo as a faculty or as a nurse practitioner, so I want to offer those benefits to other healthcare professionals. So my goal is to scale it. This difficult conversation chatbot, I want to offer it to more professions and make it an app is my goal and what I just submitted funding for a couple months ago.
What applicability does this have in the practice setting? Because really, right now, we're talking about in the education, in the pre-licensure setting. Where would a chatbot like this work in a actual practice setting?
Yeah, so we know that students, once they become nurses or advanced practice nurses, their learning doesn't stop there, right? We want them to continue to learn and grow. So how I envision it in the clinical setting, whether that's acute care hospital, a primary care setting, is for kind of that leadership to say, let's do some training. Let's continue to prepare you to have those difficult conversations. They'll be able to access the app. It's not just for academia, it's for the clinical setting as well. So they'll be able to have their nurses who may have some deficits in having difficult conversations or having some empathy in conversations with patients. They'll be able to do some of those. They can pick those scenarios, pick through the library, and then it'll give them that feedback to continue to prepare them.
Are you doing any work right now in the actual clinical practice setting that where CNOs or CNEs might think, gosh, this might be helpful in my setting?
One of our hospitals here in Omaha noticed a deficit in their nurses and techs and care providers in their psychiatric mental hospital interactions with a hostile, kind of very agitated patient, maybe a patient that's going through some psychosis. They've gone through school, they've had training and certifications, but nothing can really prepare you unless you practice it. So I developed a chatbot that has hostility, is non-adherent, is very vulgar, and the care techs or the nurses, providers can interact, which is our goal for them to interact, to practice having some of those hard conversations with hostile patients. And their goal is to de-escalate that avatar, bring it back down to a level where they can interact and safely manage that patient, which is so ideal for that population and that psychiatric setting. I'm excited to see that. We just received the funding and we'll be piloting that to see how that works.
So this is something that the nurse or tech talks to, or it's something that they type to?
Both, yeah. And my goal is to get the providers in there too, right? We all need education and training, continuous improvement, right? So you have two options. You can chat, so you can say, what brings you in? How are you feeling today? Or you can turn on your microphone and interact and have a normal conversation.
Wow. Any closing thoughts as we wrap up this episode?
I'm excited where AI in higher education is going. I think that there are valid concerns across the board that AI is not safe or AI is not setting our students up for success. But my job is to prepare students to be the best clinicians, the best providers in the future. And if we can use AI in a smart capacity and prepare our students using the evidence and really being able to navigate AI efficiently, I think we're only going to continue to see that improved student satisfaction, those improved test scores, and ultimately those improved patient outcomes, which I'm really excited about.
Faculty-guided AI chatbots for nursing education has been our episode topic. Dr. Lindsay Iverson, thank you so much for your time today.
Thank you.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.